Welcome to your Chapter 9 video lecture where we're going to talk about Section 9.2 on our fibrous joints. Our fibrous joints are going to be connected by this dense, regular connective tissue. If you think back to our tissue chapter, we see these bundles of collagen fibers neatly arranged parallel to each other, and here we have those fibroblasts in a row. This is just an illustration of that is a little bit less magnified there. And in these joints, we're going to have no joint cavity. We'll talk more about joint cavities within our synovial joints. And our fibrous joints are immobile or just slightly mobile. And we have three different types. We have Gomphoses, Sutures, and Syndicmosis. So let's look at those. First, we have Gomphoses. This is literally means like a peg in a socket, where we talk about an articulation of the teeth with the socket of our mandible over here. So you see a full picture of the mandible above. And the tooth is going to be held in place by something called periodontal membranes. So you could see these membranes in place over here. If you think back to your childhood when you lost your teeth, the teeth start losing these periodontal membranes, and so your tooth becomes loose and eventually will fall out. And it's going to function as a synarthroses. So if you think back to what synarthroses meant in our functional classification, that means we are going to be immobile here. Next, we have our sutures of the skull. We have learned these pretty well already. And we'll see that they have very short fibers. So sitting in between these two bones is where you'll find those fibers. And we see that they have an irregular shape to them, and they are going to interlock with the articulating bone. This helps to increase stability and also decreases the risk of a fracture. These sutures are also going to function as synarthroses, meaning they're immovable, and it allows for growth in our childhood. And later they will start to ossify, and we use the term synostoses in order to refer to this in older adults. And lastly, we have our syndicmosis joints. These are our bones that are bound by the interosseous membrane. So we see this broad ligamentous sheath between the radius and the ulna pictured here. Of course, this exists in the leg too, between the tibia and the fibula. And this functions as an amphiarthrosis joint. Again, a functional type of classification here, meaning that we're going to have some slight movement. And if you remember, when we are going to pronate the forearm, let's back up a little bit here. Our forearm here is in supination. So when we are going to pronate, that radius is going to pivot and move across the ulna. So that's the slight movement that we are talking about.